Hello everyone and welcome to the webinar. It begins with a connection, communicating with patients who are homeless through community voicemail. My name is Molly Meinbrust and I will be acting as moderator and host for today's webinar, which is a production of the National Health Care for the Homeless Council with support from the Health Resources and Services Administration Office of Special Population Health. This session is being recorded and will be archived on our website at www.nhchc.org. This is a 1-hour presentation with the last 10 minutes reserved for questions and answers. Below the presentation slide on your screen, there's a chat box for participant questions and technical issues. If you are experiencing an urgent technical issue, please call Sarah at 615-226-2292 for immediate assistance. Please type your questions for our presenters into the chat box at any time during the webinar. A selected number of questions will be answered at the end of the presentation during the Q&A session. Upon exiting this webinar, you will be prompted to complete a short evaluation. Please complete this evaluation to ensure that we are meeting your educational needs and have an opportunity to address your suggestions. Thank you for participating in this webinar. Today's session will focus on a collaboration between the National Health Care for the Homeless Council and Springwire to pilot test the implementation of community voicemail and resource broadcasting services in 6 Health Care for the Homeless projects. The National HCH Council and Springwire anticipate that providing individuals who are homeless with a free voicemail can help patients and providers and can help grantees meet patient-centered medical home and meaningful use standards by providing a reliable way to reach patients for reminders about appointments, greater continuity of care through consistent communication, an efficient way to broadcast information and resources that directly support improved health. Our first presenter today is Anna Landa. Anna joined Springwire in 2007. As the program director, Anna now oversees the development of new programs and pilot projects while continuing to support the great work done by the Springwire Federation. Prior to joining Springwire, Anna worked for 2 years with the Northwest Justice Project and Columbia Legal Services in Seattle on a project to expand economic justice for low-income individuals with a special focus on immigrant communities and access to financial institutions. Anna also worked for 5 years as a domestic violence victim advocate, primarily with Spanish-speaking survivors in Seattle and King County. Through this past work, she gained experience on poverty, social, and economic justice issues, and the particular barriers faced by immigrants when accessing services. Our second presenter is Tom Subarud. Tom has been the manager of homeless and mobile medical services at Family Health Centers of San Diego since January 2008. In that capacity, he oversees the Health Care for the Homeless program and its fleet of 3 mobile medical units. Prior to that, Tom was a grant development specialist with the same organization. He has nearly 20 years of experience in community and public health programming and management. Tom also serves as the co-chair of the Membership and Development Committee of the National HCH Council. After participating in this webinar, you should be able to explain why access to communication is fundamental to working with people who are homeless in a healthcare setting. Describe how HCH grantees can connect with their patients via community voicemail and resource broadcasting to provide health education information and community resources, and describe how community voicemail and resource broadcasting can help HCH grantees meet patient-centered medical home and meaningful use standards. I will now pass the microphone to Anna to begin the presentation. Anna?
Thanks, Molly. Thank you to the National Healthcare for the Homeless Council for this opportunity and especially for the partnership on this project. And this is really a unique experience for us to be able to present our program and specifically this project to a national audience. So in 2011 and for the 2012 calendar year, the National Healthcare for the Homeless Council and Springwire have been partnering to connect homeless and unstably housed consumers across 6 cities to our community voicemail and resource broadcasting programs. So Springwire, we are a national nonprofit organization based in Seattle, Washington, with nearly 20 years of experience specifically with our community voicemail program and working across the country to connect people that are isolated by poverty to the support network and services and other opportunities in their communities using technology in an innovative way. Our programs, the Springwire programs, currently consist of, in large part, the community voicemail program and the resource broadcasting programs, which I'll go into detail during this webinar. And then we also have two programs in research and development right now, including the Digital Documents Project, which is aiming to help homeless individuals have virtual copies of their important documents in the case that the actual copies get lost, stolen or destroyed. And then a resource email project to continue our work in connecting people to resources, but using email as a platform in addition to voicemail. This project is called the Health Connect Project, and more information about it can also be found on our website. This is the map of currently where Springwire programs exist across the country, and in Canada. We have a program in Vancouver, British Columbia. We have 50 sites in North America, and last year we served over 40,000 people with our community voicemail program. This network comprises over 1,600 participating social service and health organizations that provide community voicemail. And 6 of the sites on this map are the Healthcare for the Homeless projects that are partnering with us in this project. So what is the need for voicemail? And I know this might be a primary question in many people's minds, that voicemail, the term, sounds like a very outdated technology. In the world that we live in, however, it's a tool that is still very valid and useful for all of the consumers that we serve. One of the things that we know from FCC data, which is compiled every year, is that in 2011 it was found that approximately 5 million U.S. households do not have phone service, and that includes cell phones. They asked about cell phones in that survey. And we know that that survey does not actually include surveys of homeless individuals, so there's an additional group of people that are not represented. We also know that with many people may know about the Lifeline cell phone programs that are out there in many states, which offer free cell phones and a number of free minutes. I believe it's about 250 minutes given to consumers to use each month, and then they're added each month. However, we know that cell phones get lost, they get stolen, and 250 minutes, what we've heard from consumers, is not nearly enough to get them through the month for all of the needs that they have to stay connected. And we also did a survey with our Healthcare for the Homeless partners for this project at the beginning of this project, and learned from them that missed appointments and referrals are a problem with their consumer base. It takes a week on average to get in contact with many of their homeless consumers. For many of them, the primary form of contact is still in person as opposed to over the phone. And that they all told us that community voicemail, they felt, would be very helpful for them in staying connected with their consumer population. So why voicemail? For some of the reasons that I just said, that staying connected is still a problem for many folks. But we also know about the people that we're working with, that many of the individuals that we serve live in an oral culture as opposed to a print culture that many of us live in. It's a way of getting information and trusting information that comes from trusted people, from friends, from doctors, from people in their lives that they trust. So using voicemail as a tool, not just to communicate everyday business information, but also educational information, community resources. It's a medium that is trusted by our consumer base and really speaks to them. So our community voicemail program, I'll tell you a little bit more about what it is and how it works. Springwire manages the technology platform for the community voicemail program, which is a room of computer servers that house all the voicemail boxes. Then at the local level, individuals can receive a free private local phone number that is only accessible by them with a password so that they can log in to check their voicemail. It's a local phone number so that they can give that out to their to people in their community, and it, for all intents and purposes, it looks like it could be a phone number attached to a cell phone or a landline. And then by calling in and leaving a voicemail for that person, you hear a personal greeting. So from the outside, that person doesn't look any different than any of the rest of us with a cell phone. We also at Springwire we have a 3-person full-time tech team here that provides customer service to our partner sites, and in some cases individuals when there are technical difficulties, as well as maintaining the integrity of the system and making sure that we're on the cutting edge of technology. Individuals are using the community voicemail number specifically in this project for healthcare purposes, as well as so staying in touch with their doctors and their medical clinics, but as well they're using the numbers to put on housing applications. If they are seeking housing, they are putting it on job applications in order to get that call about an interview or hearing that they're hired for a new job. We have several people, many people around the country using it for domestic violence survivors as a safe number where they can be reached and not tracked by their abuser. So overall, it's a number that people are using to stay connected to their community. The Resource Broadcasting Program is connected with the Community Voicemail Program in that we can use the Community Voicemail technology as a way to send information out. So rather than just a person being able to receive an individual message from someone calling them, we at Springwire, as well as our partner sites that manage the program, can use the voicemail to send out one message that will then be received by everybody in their region that's using community voicemail. This program is being used across the country for community resources, certainly, and if there's job fairs or any kind of a resource available for folks that they might be able to benefit from. Specifically for this project, we're working with our partners to use the program to send out monthly or weekly health education information that they can adapt from resources that they already have in their programs, but as another way to send out that information. Other information that's being sent out are timely weather and emergency messages, as well as supportive messages, just a simple message at the end of the week to say, have a great weekend. One of the things that we can also use this for is to conduct very basic client surveys. So just as we can log in and send a message that's received by everybody, they can be instructed to press a button at the end of the message and reply back with some answers to some basic questions. So we've done surveying across the country for this, and we've also done one survey in this project, which I'll talk a little bit more about later. I've included in this presentation, we have a sample of one of the messages that our Cincinnati partner sent a couple of weeks ago about cholesterol awareness, and so we're going to play that now, a snippet of that message for you now.
Hi, this is Lauren from the McMicken Clinic calling with another weekly community voicemail resource broadcast. Last week I talked about National Recovery Month and behavioral health, but this month is also National Cholesterol Education Month. Like last week's broadcast, this one goes out to all community voicemail participants, so my talking about cholesterol might not be of interest to all of you, but I'll also share some healthy living tips, one from Dr. Pamela Coleman at the clinic. When talking about cholesterol, it's good to remember that many people with high cholesterol don't have any symptoms, making it important to have your cholesterol checked. The National Heart, Lung, and Blood Institute recommends that any adult at or above age 20 should have his or her cholesterol levels checked at least once every 5 years. So if you're 20 or older and haven't had your cholesterol checked recently, we'd love for you to come into the clinic and get that test done.
So now I'll talk a little bit more about, a little bit more in detail about this Health Connect demonstration project that the National Healthcare for the Homeless Council helped us with, and we're still working on. As Molly mentioned earlier, that we had some assumptions going into this, that by working with Healthcare for the Homeless consumers and providing them with a means of communication and using it to send also to send health education, that they would ultimately have better health outcomes as a result of staying in better contact. That they would also be able to show better outcomes related to the experience of health care by their consumers because they're staying in better touch. And that the community voicemail and resource broadcasting programs could help the clinics meet some of the standards for patient-centered medical home and meaningful use of electronic records, which I'll talk about a little bit more later. Some of the consumer and clinic benefits that we, again, also assumed for this project is that providing the community voicemail program is providing a basic, reliable, confidential way for someone to communicate that they may have not had before. We're also helping restore a sense of dignity to that person. Previously, they didn't, when someone asked, how can I reach you, in any setting, they may have not been able to have a good number to give, and so now they can say, here's my phone number, you can reach me at any time. It provides clinics with a way to provide continuous care without having interruptions in service and interruptions in a way to reach someone, especially if there's ongoing medical need with a particular patient. That the resource broadcasting program provides them with an efficient way to deliver health education information, as well as delivering community resource information, outside of just whether it's posting things on bulletin boards or having flyers available at the clinic. And then some information, some of what we went into this project with, working with the National Healthcare for the Homeless Council regarding patient-centered medical home and meaningful use standards. Some of the standards that we pulled out that we felt that community voicemail and resource broadcasting could help with include being able to plan and manage care by being in constant confidential contact with two-way communication, helping to manage medications, being able to notify of changes when prescriptions are available, providing self-care support and community resources through resource broadcasting, and obtaining necessary information for completing medical records, which is what having a reliable number to put on records would help with. Those are some examples, and if anyone's interested, we can provide you with more information on what we found. Our partners for this project, again, with strong help from the National HCH Council in identifying these partners and connecting us to them, include clinics in St. Louis, Missouri, Miami, Florida, Jacksonville, Florida, Cincinnati, Ohio, Milwaukee, Wisconsin, and San Diego, California. The details for this project, in terms of how it was implemented at each clinic, they were each provided, or they have each been provided with an inventory of local phone numbers for them to use, which are connected to individual voicemail boxes. All of the training and materials, best practices, ongoing support has been provided by Springwire staff. Primarily, that's been me working with all of those sites. And the ongoing support piece includes individual calls, lots of email communication back and forth, as well as quarterly group calls that we have with all the sites. All of the marketing, enrollment, and record keeping, as well as data collection, is done at the local level. So all of the enrollment, the idea is that an individual presents and needs a way to stay connected. And so the partners at the clinic are the ones they can identify that, and they can actually do the enrollment right there in their office, and that person can walk out the door with a phone number and a way to be reached. And then all of the, there is weekly resource broadcast messaging going on, and some of that is being done by us at Springwire. We're broadcasting some national resources and awareness around certain health concerns. And then our partners are also doing more local resources that apply either just to their clinic participants or to the community, their local community. One thing that's not listed on this slide, but we also have is that our partners and we can also pull reports about the usage of the participants, knowing, keeping up with are they using their voicemail boxes, as well as being able to pull data out and show information about who we're serving. So thus far, we're about almost 9 months into this project, so across the project, we've served over 100 participants, and more are being enrolled every week. Weekly broadcasting is occurring both, again, by Springwire and partner sites, so you got to hear that sample from Cincinnati was part of this project. We have gotten very positive feedback thus far from our participants. We did a survey in June, and we received at that time 15 responses, which I'm not sure what percentage off the top of my head that was, but we felt like that was a pretty good collection of responses from people. And every single person stated that the voicemail was helpful in staying in touch with their doctors and medical providers. And 80% of them said that they were using the voicemail for other non-health reasons, such as trying to find a job, staying in touch with friends and family, housing, etc., and finding it useful for those purposes as well. We have some additional surveys planned that will occur over the next couple of months of consumers, specifically about the metric that we would love to see, that people have an improved sense of their own health because they're staying in better connection with the clinic, and just more information about how the resource broadcasting piece is working for them, if they find the information useful, and if they're acting on any of that information for themselves. So now I'm going to stop talking for a little bit and let you hear from Tom in San Diego. He's going to talk about how the Family Health Centers of San Diego in the HCH program there is using community voicemail and resource broadcasting.
Thank you, Anna, and I want to thank Molly in particular and the National Healthcare for the Homeless Council for hosting this webinar this morning. So, good morning, everyone. My name is Tom Stubrud, and I'm the manager of Homeless and Mobile Medical Services at Family Health Centers of San Diego. Family Health Centers of San Diego is a private, nonprofit community health center that is located in the Central San Diego region, and we began in 1970 in the Barrio Logan neighborhood of San Diego. An interesting story about how we started: the original building was gifted to the community organizers who demanded to have health care in their community. And from that very humble beginnings, we've grown to become one of the largest community health centers in the nation. In 2011, we were able to provide care to over 128,000 unduplicated patients for a total of over 501,000 health care encounters. And today we have over 25 service delivery sites that are within the Family Health Centers of San Diego. Over and above that, the clinic has a very racially diverse population that we serve, with over 90% of patients being people of color, predominantly Hispanic or Latino, with the remainder being African American or Asian Pacific Islander. As you can see, our clinics provide a very wide array of primary health care, ancillary and supportive services to our clients. So as you go through that list there, you can see that we have primary care, dental, mental health. We have a very comprehensive HIV services department, and one note is that our HIV services department has been utilizing community voicemail for several years now very successfully. And not the least of which our programs are the Healthcare for the Homeless program, which I manage. So Family Health Centers of San Diego has a very long history with the San Diego Healthcare for the Homeless program, as we've been the lead agency since 1988 for this federally funded healthcare program. In order to serve the entire county of San Diego, which is very large, the agency has held long-time subcontracts with 10 various health and social service agencies throughout the San Diego region. Through FHCSD and all of our contracted partners, Healthcare for the Homeless services are provided at approximately about 20 delivery sites throughout the entire county. So, and as you can see, the project has always been a very busy project. We served over 23,000 individuals through over 85,000 healthcare encounters in 2011. So the services provided by the project obviously mirror the services provided overall by Family Health Centers of San Diego. And those services ranging again from primary health care to restorative dental, to psychiatry and case management, and referrals for alcohol and drug treatment. So we really are we have a very broad depth of services that we're able to provide through us and our partner agencies to our homeless clients. So how did we begin our partnership with Springwire and Health Connect? Well, we were approached by Springwire in early 2012, and we were asked to participate by Springwire and the National Healthcare for the Homeless Council, and we were asked to participate in this Health Connect project, this pilot project. And so the partnership officially began in May of this year, and here's where I have to just put in a plug for the exceptional training and the support that Springwire has provided to us as a pilot project partner. So that ranged from the face-to-face training that they brought to us in San Diego, to the ongoing technical support, the really high level of communication, and the overall level of commitment to this project has really been exceptional from my vantage point. So to date, through our Healthcare for the Homeless project, we've been able to enroll 26 individuals into this pilot project, and that's really been at about a rate of maybe 1 to 2 individuals enrolled per week. We have 3 specific Healthcare for the Homeless staff, which includes 2 social workers and a patient assistance benefits specialist, who are all responsible for identifying these potential clients for this service and then working to enroll them at that point in time. The other feature that Anna has talked about is the weekly resource broadcast, and this is a feature that not only us but I believe the other pilot project partners have really begun to use more frequently in the last several weeks. So what that does for us is it really allows us as a project to connect with the entire group of individuals who are subscribed to this community voicemail service. And so we're able to tailor and send what we feel are really important messages about prevention, about general health, about access to care, and really how to remain connected with our health center. That's one of the big goals, obviously. So the weekly resource broadcasts, we found them to be, I think, a very nice additional point of contact that we're able to maintain with our clients. So a little bit more about the Health Connect project and our Healthcare for the Homeless program, and what are some of the benefits of this project that have really been shown to be evident from the beginning. So first off, it really is simple and it's really effective. The enrollment is a one-page intake form followed by an agency permission form that our staff are able to complete with clients. It really, once that is filled out, it takes just a couple minutes, I think, for staff to establish the patient with their new voicemail box. Staff then send that information to me, and then once I receive those documents from staff, it really takes me between about 3 to 5 minutes to input each new subscriber. So it's very user-friendly. It's a very easy-to-navigate system, and I think most particularly, it's really easy for clients to begin using the service right away. That's our goal, is to get them connected with our social workers, with our health center in a more meaningful kind of way. And for us, as a Healthcare for the Homeless agency, we're really making a shift towards a more intensive social work model through our Healthcare for the Homeless project. And so Springwire and community voicemail really becomes one more very important tool that we have in our toolkit that we're able to use both as a communications tool and an incentive to our clients to sort of remain in contact with our staff, with the goal of really helping them become either more self-sufficient or access information about jobs or housing or whatever that need might be. And it really, the community voicemail product really allows us for another point of contact with our consumers. So if they become enrolled, maybe they don't have an appointment scheduled, but maybe they're coming back to the social worker's office to use the phone to check their voicemail. So it becomes this very nice reinforcement, kind of cyclical thing that we see with our clients. And sometimes it might take 2 to 3 times for them to hear about the service, for it to be offered to them, for them to become interested in community voicemail. And staff just continue to offer the service over and over to these folks. And as I already mentioned, and as this slide notes, the resource broadcasts are really an easy and efficient way to get this really valuable information out to a lot of people all at one time. So some of our recent broadcast messages have included information on sun safety, given that we're in a very hot, sunny climate here in San Diego. So we've included information on hydration and skin protection. We've sent out information about general prevention messages, knowing your weight, knowing your cholesterol, knowing your high blood pressure, probably a very similar message to the Cincinnati message that you heard a little bit earlier. One thing that I really have learned from Springwire, which I find I really like it as a feature, is I've really been adding inspirational quotes at the end of each of our messages that we send out. Just a nice kind of a feel-good sentence, a feel-good quote. Plus also in each message really trying to instruct patients on how to continue to make appointments with family health centers, and also reminding them to tell their friends about the service if they found it to be very beneficial. And so just quickly, I do want to, I've gathered a little bit of information from staff who have been working with a few particular clients who are enrolled in the community voicemail program. And so I just want to read what they've written about these clients. The first one says, once I finish helping them set up their number, most of them are surprised at how easy it works. I've had patients that are using it on their resumes, and some come by on a regular basis to use the office phone to check their messages. Another staff member says, the first client we enrolled uses community voicemail all the time. She checks her messages on a regular basis from one of our phones. Her son is in a juvenile facility, and community voicemail has really been useful for her to receive messages regarding her son's care. It's also been useful for employers to contact her for odd jobs here and there, and she is extremely thankful for this program. Another client mentioned that now he has a way for his family to keep in touch with him, and especially for keeping in contact for his doctor's appointments. In the past, he would miss appointments due to not having a message phone number for receiving reminder calls, and again, he is extremely pleased with this program. So we've been as a pilot project partner, we're very grateful to Springwire for including us in this really important project, and we have really started to see the success that this collaboration can bring. And so with that, I want to turn the microphone back over to Anna.
Thanks, Tom. That was really great to hear from you, and it's been really wonderful working with the family health centers and with Tom in particular. They've gotten the project off the ground really, really quickly, just joining since May, and it's been really wonderful to see how much of an uptake there's been and appreciation for the program. So thanks again, Tom, for working with us and being on this webinar. It's great. So I want to talk a little bit about what we've learned and what some best practices are that have come out of this project, as well as some things that we did. We may have already known through our 20 years of experience, but it was reinforced through this project, through this pilot project. One important thing for the community voicemail program is that all staff at the facility, at the clinic, at the social service organization, wherever it is, that everybody in the organization knows about the program. And that's so that referrals can occur from wherever within the clinic. Whichever staff member feels that this person could benefit from a community voicemail number or getting the resource broadcast or whatever it might be, that everybody has an understanding of what the program is and what it does and how it could be beneficial to people, from the executive director throughout all the rest of the staff members. Having a consistent referral point in terms of knowing, so that staff and clients know where to go. Who do I talk to in order to get this community voicemail number? that communication is very clear, so people aren't running around trying to figure out, how do they get connected to this number. Having a visible marketing campaign is also very important. Not just, I have an example here of a flyer that was posted, that's been posted throughout the clinic. So having consumer or patient awareness of the program so that they can self-refer to the program, but also having marketing and materials distributed among staff, maybe that they can keep by their desk, above their phone, in their office, that they're constantly reminded about it as well. Having clear talking points ready on people's tongues about cell phones versus community voicemail. We're not in the business of trying to compete with the cell phone market out there. We know it's much more accessible these days, but we also know from our consumers that the free cell phone market is not meeting their needs on a consistent basis. And so community voicemail can be a complement to a cell phone, and the community voicemail can be that number where everybody can always reach them, regardless of whether their cell phone gets lost, stolen, doesn't have enough minutes, and doesn't work, whatever it is. So having those clear talking points is important. And then kind of connected with the first point is that having the program be top of mind for all staff is really important as well, so that it's not something, thinking about a person's communication access may not be top of mind for a doctor or for a nurse or for the receptionist at the clinic, but it's having it always be present in their mind, because it may not be something that they always think about as a normal course of their job. It's a supportive service, but it's a supportive service that really will make a difference for people. Some best practices specifically connected with the resource broadcasting program that we've learned is that it's very important for people to have a weekly schedule, and this would be the staff person who's responsible or who's taking on the resource broadcasting for the community, for the clinic. And it's important having that weekly schedule so that it's always, again, it's top of mind. If it shows up on your Outlook calendar once a week, you're not going to forget to do it. You don't have to remind yourself to do it. It also, once you have that weekly schedule, you get into the practice of it, and as you start seeing resources come across your desk or information about a health fair or whatever it might be, you'll automatically think, oh, that'll be great for my resource broadcast later this week. That could be useful to send out. Also having all staff know about it so that they can be feeding information for the resource broadcasting. It's something that they can market to the clients about the community voicemail. It's not just a number where we're going to call you, but you're also going to get information sent to you that can be helpful to you in other areas of your life or staying connected to the clinic. Rather than reinventing the wheel, it's important for people to keep in mind that they don't have to invent resources. There are resources scattered throughout the clinic that could be easily adapted to send out as health education broadcasts to people. So rather than feeling like it's one more thing on top of this that I have to create some new thing, it's a matter of just figuring out how to adapt those resources to a voice broadcast in more of a sound bite, or it could be a series of sound bites about a particular issue. Again, I kind of had mentioned this as well, keeping it in mind so that when you're just out in your job and out in your day, that resources are being fed through your mind that you could broadcast later. Supportive messages through this project as well as through other projects across the country, we've found to be really appreciated and kind of a more important or more impactful than we initially thought. We're talking about folks here who may not be getting messages from many friends and family. They may be disconnected from friends and family, and they might not have a very large support network in their lives outside of, coming to the clinic and getting good information from their doctor. So sending those supportive messages really sends that message that somebody cares about them, somebody's thinking about them, and really wishing them well. And we don't have data to show what kind of impact that might have on somebody's health, but I can only imagine that it would be beneficial just in somebody's life. And asking for periodic feedback from consumers is recommended as well. Staying in touch with what their needs are, what do they want to hear about, as well as maybe asking them for how beneficial is this for you, or do you appreciate this? Is this something that's useful for you, so that you're providing a useful resource for them and not feeling like you're working in a vacuum. So the next steps for this project, we are continuing through the end of December with the current partners, and they will be continuing to implement the programs at their clinics, both enrolling people on community voicemail, looking for new opportunities for enrollment, as well as continuing to send out resource broadcasts and looking for resources to connect people to. We're going to be, as I said before, we're going to be doing additional consumer surveys about both resource broadcasting and community voicemail, their perceived health, and we will also be doing follow-up surveys with the clinic providers to kind of bookmark the pre-survey that we did and see what kinds of changes they've noted throughout the year. We'll also be writing a final report with the National Healthcare for the Homeless Council that we'll be working with them on to kind of wrap up what we've learned and what the possibilities are for expanding this project out to other partners, as well as continuing it with the partners we're working with now. And so I just wanted to leave you, as I said, we did some surveys, and we got some really wonderful testimonials from people. We sent a survey basically asking for almost yes and no answers so that they wouldn't feel like they had to provide a lot of information. And what we got was these really wonderfully rich testimonials from people about the voicemail and about how it's helping find work and staying in touch with family. And as you can see from these quotes, absolutely helping them stay in touch with their doctors, improving that ability to stay in touch with their doctors. So I wanted to leave you with that, and then I will pass the mic back to Molly. And again, thank you for spending time with us today and listening to us talk about this project.
Thank you, Anna and Tom, for your involvement in this project and your excellent presentations today. I will now begin the Q&A session. So the first question is for Anna and possibly Tom as well. What phones do clients use to access their voicemail? Go ahead, Anna.
Yeah, that's a great question, Molly, and it's one that we get a lot. And I'll let Tom also answer so he can talk specifically about what they do in San Diego. In general, one thing that we've learned is that our clients don't necessarily have a problem with access to phones and having phones in their life of where they can make calls, but they don't have access to getting messages that are personal and reliable and confidential, and that they can always know where they can get get messages, as opposed to having someone at the shelter take a message for them and post it on a board. So we've learned from folks that they're checking their messages in a variety of places, very frequently at the agency or the clinic that gave them the number. And as Tom mentioned earlier, that their patients are using their phones to check their messages and see that as a reliable place to do that. And then I also do want to note that some of our clients do have cell phones, and they are using them in conjunction, so they prioritize their minutes to be able to check their messages and then make decisions about who to call back on those few minutes that they do have, as well as shelter phones, kind of a variety of places. It used to be pay phones, and that's certainly not the case anymore since there aren't very many of those left. So thank you, and I'll let Tom answer too.
Yeah, thank you, Anna. Yeah, I would say, as I mentioned in my slides, staff through our Healthcare for the Homeless project do let clients utilize their phones on their desk phones, to check messages, and so that seems to work very well. And I think, like I mentioned before, it's also that becomes another point of engagement with our clients. So maybe they're not coming back specifically for an appointment, or maybe they're not coming back to see a provider or a social worker, but they're popping into the clinic. it's allowing staff to continue to build that rapport and that trust with their clients. And it just really, I think it helps us as kind of a, I don't want to use the word hook, but I'm going to as a hook to get folks really involved in the program a little bit more. And as Anna said, I think a percentage of clients do have cell phones, but many probably have a prepaid service, so they're limited in their number of minutes. So I think using that very judiciously to where they can use a landline to check the messages, and then if they choose to return those calls on a cell phone if they have access. So thank you.
Thank you, Anna and Tom. The next question is from Claudia in Miami, and she's asking who she should contact for information to get this type of project started at their clinic, including costs and details about setting up the system. So I'll give that to you, Anna.
Sure. Claudia, I would be happy to chat with you offline and tell you who to get connected with. Our partner, we do have a partner in Miami, Florida. It's the Community Health of South Florida. And we do have a couple folks there that we're working with. They're working on implementing it. And I know that there's kind of a network of clinics for healthcare for the homeless in Miami. And so off the top of my head, I can't tell you exactly which ones they're working with, but I'd be happy to chat with you offline if you want to email me or call me, and we can talk in more detail about what to do in Miami.
Thank you, Anna. The next question is for Tom. How does enrolling patients with community voicemail fit into the clinic workflow?
Into the clinic workflow. Thank you, Molly. As I think I mentioned in our slides, we're really moving into more of a trying to be a more intensive type of social work model. So our social work staff are assessing clients kind of at several different levels. So that could be support systems, finances, health, kind of a whole battery of sort of assessment questions. And so I think as part of that, as they're getting to know the client and getting to know what resources they have available, it becomes a very natural addition to other services that we might offer. So, for example, we may offer to refer them to Legal Aid Society if they've got some outstanding warrants or legal issues. We might refer them to another agency that could assist them with obtaining a birth certificate or other documentation. So it just becomes, I think, like I mentioned, just another tool in our toolkit to say, hey, we also have this community voicemail service. It seems to me that this might be something that you might benefit from. So is this something that you're interested in? So I don't think it's not extra burdensome to our staff. In fact, I think the opposite, that it gives them one more thing to offer to our clients. So thank you for that question.
Great, thanks, Tom. The next question is for Anna. How do your participating sites fund these services?
For this particular project, we have been funded from the National Healthcare for the Homeless Council with some funding that they were able to work with us on to provide this service to these clinics. So currently the clinics are not paying us for the program at this time, although they are having to redirect some staff time, which of course I'm sure somewhere shows up on maybe on as a line item on a budget sheet somewhere. But as far as our other projects around the country, they fund it through a variety of ways, through kind of health and human services, departments in cities, counties, and state governments, through United Way funding. One of the things that we're looking at now is coordinated entry programs in communities. I know that's a big effort across the country. So trying to get community voicemail written into those projects to be funded, so that staying in contact or having a way to reach people as they're being ushered through the social service system is a good idea, or we can see in some examples. And then of course, private foundation and corporate grants, just like anybody else. Thank you.
Thank you, Anna. The next question is for Tom. How do you determine which clients would benefit the most for this program? This individual has community voicemail at their HH project, and they've been targeting chronically homeless and street homeless, and their user rate is low because of their lack of access to telephones. So is that a good route to go about, or should they be targeting clients more at the shelters instead?
That's a great question. Thank you, Nida, for that question. And thank you, Molly. How are we determining which clients? I think part of it is that, yes, I think we have to admit that there are some chronically street homeless who are going to have a lower utilization of the service due to a lack of phones. But I don't think that should preclude them from being, from it being offered to them. I think our staff, our social work staff, are working with folks who are maybe a little bit further along towards kind of a self-sufficiency. Folks who are, it's sort of how we kind of track and process for some of our other programs. So we can kind of look at someone who maybe they've taken some steps to get into some treatment programs, if that's either substance abuse or mental health. Folks who are really making an effort towards finding a job. So staff are working with them on resumes. So it's folks who are maybe a little bit further along that kind of continuum and a little bit further progressed. Again, that being said, the utilization, it's sort of like, that's a big piece of it. So we need to ensure that we're getting the best utilization rate. But so I don't know if that's an incredibly helpful answer. I think it's really got to be based on that case manager, social workers, sort of ability to assess the client where they're at, and really work with them and to determine. And I think it also becomes an incumbent upon us to continue to promote the services and then work with other agencies to see if they might be able to allow access to their telephones for folks to check messages, or work with local libraries, which actually may have a bank of payphones that folks can use. So I think just to think outside the box a little bit to help to bump up that utilization rate for as many clients as possible. So thank you.
Great. Thank you, Tom. The next question is for Anna. Can you send targeted broadcast messages to specific patient populations within your clinic, such as your patients with type 2 diabetes or hypertension, et cetera?
Thanks, Molly. At the moment, we aren't able to do that with the technology that we have. It is limited at the moment to being able to send information to everybody. But one way that we've worked around that in the past is if there is information that's specific to a certain population, we kind of give a really brief announcement at the top of the message saying, this is a message about X, about hypertension and diabetes. If you're not interested in hearing this message, you can press 3 to delete at any time. And so it gives the person a little bit of control over whether they want to listen to the information or maybe save it for later. That's another thing they can do, is save the message and listen to it later if they'd like. So that's how we've worked around not being able to segment the calls at the moment. Thanks. Good question.
This individual is asking, what is the cost of the service for community voicemail and resource broadcasting? I'll give that to Anna.
That's a big question. So the cost, it really depends on the size of the program. And so we have, I don't think we have information up on our website right now about the cost, but I would say for, for one of our programs trying to think of an example, our Seattle program is quite robust, and so it includes the technology as well as it includes staffing. So, including that, the staffing is the biggest piece of the cost. And so it's hard to answer the question because the voicemail technology piece is variable depending on how many units you have for your program, et cetera. But I would say for a program with a full-time staff person in a community serving a large number of people, say with 1,000 voicemail boxes for their community, it's probably a $50,000 to $60,000 a year program. and that's not paid to us. I mean, most of that is staffing. You know, I would say that's $40,000 of that is going to the staff person, you know, paid from the agency that's managing it. But then programs, we have many programs that are much smaller than that, and these, you know, these folks are managing about 100 numbers, and certainly not full-time staffing. So it's hard for me to give you a number about how much it would cost, because it really does depend on the size. But the voicemail boxes themselves, you know, for a small number, I believe we charge them at less than $2 per box per voicemail or per month to many of our programs. And again, that number changes depending on many factors. So thanks. If you want more information, please email me and we can get into the details of what it might look like for your community.
And I'm sorry, can I jump in here, Molly, really quick? If I can make a comment about the cost. I think also we need to look at services like this in the cost savings realm, that if as community health centers and HCH programs, we now have access, we have given access to clients to allow them to stay in better contact with their primary care provider. You know, you extrapolate that out to the very end, and we're hopefully going to be really reducing emergency room visits. We're going to be reducing greater costs that are going to come down the line when this person hasn't accessed care, versus now they're able to stay in contact with their doctor, with their primary care provider, and get into care sooner. So I know those are difficult numbers to get a hold of, but I think we need to work towards making those cases as well. So thanks.
Thanks, Tom. Okay, we've got a couple more questions. We'll try to move pretty quickly. This question is for Anna. Can you elaborate more on how this program helps clinics meet standards for patient-centered medical home and meaningful use? And Tom may have an answer as well.
Sure. And again, this is information that we worked with the National Healthcare for the Homeless Council on coming up with which standards might be met or helped in being met using community voicemail. So literally, you know, I kind of have a list here of things that we came up with together that we felt. So really the basic idea though is that at the root of being able to stay in touch and have a consistent way to reach a patient, that you are able to just provide them better services and be able to provide more consistent and more continuous care. Again, some of those things were around people are on the hook for planning and managing care, managing medications, providing self-care and support, decrease the number of missed clinic appointments, decrease the number of missed referral appointments, you know, having a better ability to remind people of preventative care and chronic care. So all of those things are made easier if you have a phone number where you know you can reach someone and leave them a message, and know that they're checking those messages. Obviously, kind of what Tom said earlier, it really does. You might be making decisions about who do you offer this program to based on what is your sense of where are they in their life, and where are they in being able to manage something like this in terms of, you know, staying in constant contact. And then the resource broadcasting piece comes in really when around the standard of providing health education information to people. This is a very inexpensive way to provide information to a mass group of people, depending on how many people are using the community voicemail, in a very quick and easy fashion. You don't have to go to the printer and create flyers, and you don't have to create mailers. It's just some some information that you can send out using the voicemail tool. So I hope that was enough of an answer. Any more specifics, we could. It might be a longer conversation, but thank you.
Thanks, Anna. And I'm sorry, I think we're out of time, and we had one last question. We'll try to answer that offline. And thank you all very much for submitting those questions. Thank you for joining. It begins with a connection communicating with patients who are homeless through community voicemail produced by the National HCH Council. Also, consider registering for our upcoming webinars. We have one tomorrow, September 27th at 1 p.m. Eastern, Connecting Homeless Individuals to Medicaid and Healthcare Services, Key Lessons from HCH Administrators and Frontline Workers. and another webinar on Tuesday, October 9th at 2 Eastern, Homeless Persons Memorial Day, How to Plan, Organize, and Remember. We invite you to visit the National HCH Council website for a full listing of upcoming and archived webinars as well as other educational projects. This meeting will now be closed.